Okay. For last week's homework, you watched a video on health called the Latin Pulse. So Latin Pulse, Healthcare in Latin America. And then for the homework this week, you're watching another short health video called The Clean Bill of Health, focused on Cuba. And so I'm going to touch on both of those right now. The one from last week and the one for this week. One of the homework questions last week asked which countries are addressed in this video. And so this is a list of those countries. Colombia, Guatemala, Venezuela, Chile, Bolivia, Cuba, and Mexico. Then we're introduced to some of the problems that specific countries in Latin America were encountering. So in Colombia, the problem was that medical care is unaffordable. And there were pharmacies that were overcharging for prescription medication. So that's the problem in Colombia. And then we were introduced to what Guatemala was doing to try to address that kind of issue. So Guatemala, what they try to do is to make their own medicine. If it costs too much, if the medicine costs too much, then what if the government tries to make their own medicine to make it affordable for their people? That way they're not paying big pharma. But like you learned in the video, then they got sued by big pharma, by the US pharmaceutical Pfizer, because they claimed that the medicines they were making, were infringing on the patents of Pfizer. So now what they do is, so now what Guatemala does is they have their Ministry of Health that has their own government pharmacy called PROAM. And what they do is that they buy medicine, all the most popular medicines, they buy them in bulk to get them at the cheapest price possible. And then they sell them through the government pharmacies to, again, make them as affordable as possible for their public. And so, let's see, I have a link here. And so this is Guatemala's catalog of the medicines that they make available, very affordable to the people of Guatemala. Let's see, started with A's, B's, C's, and so forth. So but yeah, that's what they do. They so that's an update on what was covered in the video. In the video, they just said they try to make their own medicine and Pfizer sued them. And so an update to that, not included in the video from lecture, is that Guatemala ended up buying in bulk and creating their own pharmacies to sell them at cost to their public. Venezuela, what they did to try to address this issue is that the government would limit the price that private clinics can charge for services and medicine. And so that's what they did in Venezuela to try to address the issue of healthcare being unaffordable. In Chile, what they did to try to make healthcare more affordable and accessible is they made medical care free to anyone who cannot afford it. And with that, I should also bring up, there's drawbacks as well. Like really long lines or having a shortage of doctors and things like that. So it's not just a matter of making that decision. It's, there's also the issue of countries, the degree to which they can afford to subsidize these important things. And at the end, we get introduced to medical advances in Cuba. One of those is a vaccine that prolongs the life in lung cancer patients. That's all that was covered in the video. So the rest of this is new from lecture. The name of that medicine is Simovax, EGF. And the United States is, how do I put it, is running clinical trials to make that medicine available for lung cancer patients in the United States. Pfizer is one of those companies that is working on that. US clinical trials, last time I checked in December, US clinical trials were in phase 2 and 3. All right, then there is the health video for this week, which focuses on Cuba. Part of what we learn in that video is that Cuba's health indicators are better than most countries in Latin America. Some of those health indicators are even better than in the United States, where Cuba's child mortality rate, for example, is lower than in the United States. Then there is the US embargo. Oh, I'm sorry. We usually call it the Cuban embargo. But I think it's more appropriately called a US embargo against Cuba. And so this is something that came about because of the Cold War and Cuba's revolution in 1959 that led to them becoming communist and allying with the Soviet Union. And so the United States imposed economic sanctions to hurt the Cuban economy. So Cuba cannot trade with the United States, and all the other countries and corporations of the world also need to decide between if they trade with Cuba, then they cannot trade with the United States. And Cuba is a small, kind of economically not very significant island, and the United States is the largest economy in the world and one of the largest markets. So it just makes economic sense for most countries of the world to want to trade with the US and not with Cuba. And so Cuba's economy is hurt. With regard to healthcare, the US is a world leader in medical research and medications. And so we learn in this short video that Cuba has had to make do without access to US medical research and medications. Hence this quote of adversity is the mother of creativity. They've had to go low tech. They've had to just make do with what they have available to them. And somehow they've managed to have the best health indicators in Latin America, despite despite the economic embargoes against them. And even though the Cold War ended around, I don't know, around 1990, between 89 and 91, the US still upholds an economic embargo against Cuba. In fact, the United Nations, last year was the 32nd year that the United Nations voted to end the Cuban embargo. All countries voted to end the Cuban embargo, except for the United States and Israel. Oh, and I think last year Ukraine also abstained. Now, you know, the UN can't end the embargo. It's only US Congress that can end it. But how do I put it? Cuban Americans are among the people in the United States most opposed to ending the Cuban embargo. And so then, you know, the Ted Cruz's and the Marco Rubio's and, you know, the Cuban American politicians in the US are among the most opposed to it. And so it still hasn't happened. We get introduced to the International Medical School in Cuba, or Escuela Latinoamericana de Medicina. The purpose of this is to educate medical doctors, so to make doctors. And people from all over the world, including people from the United States, can and do go to Cuba to become MDs, to become medical doctors. And they can do so for free. What they ask in return is that these new doctors spend 2 years in any part of the world where there's a shortage of doctors. That's how you pay them back. Now, the United States critiques this international medical school. It critiques it by saying that Cuba only does this to help get votes from the United Nations, and that Cuba uses the doctors like a resource where they trade them with other countries for things like oil. And so, for example, with Venezuela, they absolutely do that. They tell Venezuela, you got oil, we got no oil. You need doctors, we have doctors. And so they do that. Then there's 2 last questions. These 2 questions are based on both videos. The one for last week and the one for this week. And these 2 questions differ in this highlighted area. And so make sure that you're answering that part of it. Who provides the highest quality of healthcare? Is it private industry or state-run healthcare? And I would argue that it's private industry that provides the highest quality. And that's because this is also true in Latin America. If you can afford it, you can buy the best, you know, top-notch healthcare. That, yeah, you can have access to the best healthcare that money can buy if you can afford it. And they also, you know, fly to different parts of the world. You know, it's not uncommon for people to fly, you know, to Rochester, Minnesota, to the Mayo Clinic for specialists who do specific operations, for example. But in Latin America, they have high quality healthcare to those that can afford it as well. Then the other question is very similar, but has a different highlighted area section. Who makes healthcare available to the greatest number of people? That's different from which provides the highest quality. Who makes healthcare available to the greatest number of people? Is it government or private industry? Here, I would argue that it's government with their state-run healthcare. And so, because government will not only have clinics and doctors where it is financially feasible, they will also have clinics and doctors in rural areas and remote areas where there's a need, because their purpose for providing these services is not to make a profit. And so then they can make it available. Now, granted, this system is not going to be high tech, as high tech, is not going to be as readily available. It can include, say, long lines of waiting, but it has a different strength. Comments, questions, slides to go back to? Yes.